Hear, hear. Hear, hear. Hear, hear. Parkinson's Podcast. Welcome to the Hear, Hear Parkinson's Podcast, where you will hear from special guests covering the world of Parkinson's with a deep dive on the World Parkinson Congress and a look at how the WPC has helped make extraordinary progress in the Parkinson's community by creating space for people with Parkinson's to have a seat at the table.
All right, welcome everyone to the WPC Here podcast. This is Eli Pollard. I'm the Executive Director at the World Parkinson Coalition. I am very excited today for this podcast. I am joined by WPC Science Ambassador Roberta Marongiu. Roberta, do you want to say hi and introduce yourself?
Yes, hi everybody. I'm really excited to be here on this exciting episode. I'm Roberta Marongiu, as Eli said. I'm a scientific ambassador for the WPC. I'm also a neurogeneticist and neuroscientist at Weill Cornell Medicine, and we study the role of biological sex in terms of genetics and hormones on Parkinson's disease. I'm really want to hear what our fantastic guest has to say about this.
I will say when I asked the team who would like to co-host the session, Roberta very quickly raised her hand. So she was very excited about our guest today. And our guest today is Professor Sarkis Mazmanian, who is I'm excited to have here today, going to talk with us a little bit about his work on microbiome and all the other things he's doing. But for me, it's always nice to see a guest come back around because Dr. Mazmanian was at the WPC in 2016 in Portland, and he is on the program again in 2026. So I think we have a lot to talk about. But welcome, Dr. Mazmanian. Could you do a brief introduction of yourself?
Hi, Eli. Hi, Roberta. It's wonderful to be here. And I remember that meeting in 2016 quite fondly. And so I'm glad that we're going to revisit some of what I learned in that meeting and what I experienced. So just briefly about me, I'm a microbiologist by training and really started becoming interested in microbes that are beneficial, microbes that actually improve human health. We work almost entirely in animal models, but we want to understand the flip side of the coin. I think many of us grew up thinking microbes were these insidious little creatures. They just want to make us sick, but we now know that largely through research in the microbiome, that there are many microbes which support health, and those are the ones that we focus on. And we've worked in a variety of different contexts, inflammatory disorders, behavioral conditions, but a large part of our lab's effort now is studying the gut-brain connection in Parkinson's disease.
Which is amazing. And I'm so glad to have you here. I will say that in 2016, I'm not a clinician, I'm not a scientist. And I remember when we were designing the program back for Portland in 2016, and there was a lot of excitement around the microbiome in Parkinson's. And at the time, that was maybe 2014, we were designing the program. That was, for me, not a non-scientist, very new. I hadn't read about the connection between Parkinson's and microbiome. And I think I wasn't the only one that was excited because when your session took place in Portland, if I remember correctly, your session was one of the ones that was so full that the fire marshal had to close the door. I think people were like sitting on the floor. They were standing in the aisles. People were mad that we had put you in a room that didn't seat 1,000 people, but we were like, we had no idea this was going to be the session of the conference. So it's wild. And obviously I wasn't the only one that was excited about that topic and connecting it to Parkinson's. So what are your that was 2016. We've come 10 years. What was your experience at that meeting, and how have things changed since then? A lot has changed, I'm sure.
Well, it's not just you who hadn't appreciated or even heard about the connection between the microbiome and Parkinson's. It was most people because it was such a new area of research, and we were one of the first labs that had made that connection. Again, our work is in preclinical laboratory animals, but it's become an area that I think is really on sort of the frontier of Parkinson's research now, and very much an emerging area of study, and I think we'll get into some of the details and its implications. But for the meeting itself, it was quite flattering to see the turnout that you're describing, but also to engage with really the patients and the caregivers and their families. Of course, I met many researchers and clinicians there, but what really impacted me and was memorable were some of the stories of the individuals and their loved ones that related to the topic that we discussed. And so at the time I talked about our first and only paper, again back in 2016, where we had shown that if you just make wholesale changes in the microbiome of a mouse model that overexpresses alpha-synuclein, that has many features of Parkinson's, that all of the symptoms go away, or can change, and the actual aggregates of alpha-synuclein in the brain are modulated by the microbiome. It's really just a cursory study, one that just made a connection more than anything else, didn't really understand the underlying biology, which we're still trying to do and other labs are trying to do as well. But I think that just implicating, maybe not so much the microbiome, but the gut in Parkinson's resonated with individuals who are living that experience. And I just remember a couple of the stories that I heard. I remember just right after I gave the talk, a man came up to me, and with I presume his wife next to him, and said that on a couple of occasions for dental work, he had been given antibiotics and his symptoms improved dramatically, which was gratifying because that supported some of the work that we had done in animals, but also really put that work into context because it gave me at least the first glimpse into the fact that there may be, again, anecdotal, but some implications for the microbiome. Others had, I recount many stories of people telling me about their gastrointestinal symptoms. They are largely in the form of constipation, but other GI symptoms as well that really were affecting their quality of life. I remember a gentleman mentioned that very early, or in the early years of his diagnosis, it was really his GI symptoms that gave him much more discomfort, and again, eroded his quality of life than his motor symptoms did. I think eventually, I suspect his motor symptoms became worse. But again, I think that frames this biology in a way that suggests that maybe there is a gut-brain connection in Parkinson's, and if so, I think that's just ripe to be leveraged for both understanding biology and potentially developing therapies. And then again, I had talked to another individual, which I remember, who told me that for his constipation, he had gone in for a colonoscopy. And as you know, part of the colonoscopy procedure is a clean out prior to the colonoscopy, and he just described how for several days or weeks after the colonoscopy, his motor symptoms, his movement disorder was ameliorated. So again, very anecdotal, but again, real world, and it's really those messages that hit home and gave us some inspiration to continue the work that we were doing.
And I think the importance of this topic is not just in the novelty, like you were discussing at the beginning, Eli, that it was a novel topic 10 years ago and everybody was excited about this new, gut-brain connection. But it's like Sarkis says, the importance of trying to identify ways that we can actually develop therapies that are like modifiable risk factors, right? That's something that we can develop hopefully fast, or something that we can take like antibiotics, for instance, something more simpler, just adapting our diet or changing our lifestyle, that could maybe come into play. And that's, I think, where the very exciting part of all these studies is as well. So
Yeah.
can you tell us, Sarkis, a little bit about what's going on right now? What's cooking? What are
Yeah,
the
yeah,
news?
yeah, absolutely. And Roberta, I couldn't agree with you more, right? Is that I think, whether it's the microbiome or the gut as a conduit, let's say, a way to access the brain really opens up a lot of options, both for, again, understanding biology, but really, trying to improve the lives of people with Parkinson's. And it's quite fascinating, I think, in some ways to think about a classical brain disorder having this component that's outside the brain, right? And again, it's not just the gut, right? We know that other organs are clearly involved as well. But the gut has I guess, a special place in my heart because we do microbiome research. But again, it's also accessible through oral medications, right? And I think that aspect of it really is one that we're quite excited about because, in many ways, the microbiome hypothesis in Parkinson's is still that. It's a hypothesis, right? And we're still working to try and understand whether the microbiome contributes to Parkinson's, and if so, how does it contribute? And there's, again, many ways that could happen. I don't believe the microbiome changes are causal to Parkinson's. I think there has to be another, in most cases, I think genetic or other predisposition or vulnerability, and the microbiome is a modifiable factor in disease. Again, I think that's the best case scenario if the research plays out over the next few years. And to your point, Roberta, is I do think that gives us the option to intervene and improve gastrointestinal symptoms, but maybe even, brain symptoms and the course and trajectory of disease itself, right? When we're still in 2025, not able to correct mutations or really even know what our genetic targets are in Parkinson's or many, many other disorders. But just improving gut health and improving microbiome health is modifiable, whether or not that's, the part of the pathophysiology. Again, the research still needs to be done, but it is a point of intervention and one that's actually, relatively speaking, not difficult. Right. There are ways of whether it's, targeted, and this is, to your point of, what is the latest and, potentially greatest on the horizon for therapeutics, whether it's something targeted like a particular bacteria, think of a probiotic that you may get from a health food store. It's going to be a different organism at the end of the day. It's not going to be something that's commercially available, but the ability to take, let's say, if you do the research to know that a particular organism can be therapeutic, the ability to take that organism and encapsulate it and distribute it is quite straightforward. So I think that this is one way that we can, and very, very safe, right? Especially if that organism comes from healthy humans, there's very little likelihood that there are going to be adverse events. There's many, many studies in other contexts, non-PD contexts, that suggest that safety is just not an issue. And so I think this just really lowers the bar for us to be able to get therapies into individuals who may benefit from them. But of course, there's a lot of evidence that needs to go into identifying a particular organism or a particular molecule from an organism that may be helpful, prophylactic or therapeutic in PD. Much more research needs to be done. What we're excited about is literature that's already emerging, not from us, but from clinicians on fecal transplants. And so fecal transplants, or otherwise known as FMT, fecal microbiota transplants, are essentially the wholesale transfer of healthy microbiomes into individuals who may be suffering from a particular condition. I think there's something on the order of 7 or 8 papers now that span geographies from Europe to North America to Asia that have shown some level of efficacy using fecal transplants or FMTs in Parkinson's disease, the effects are still small, and oftentimes the effects are just in improving constipation or other GI symptoms. But a couple of the reports go further and show, modest improvements in the movement disorder itself. And I think this is really, exciting because, I think there's obviously the whole therapeutic aspect of it, but there's also the proof of concept component, right? That's, just changing the microbiome and not changing other aspects of a person's physiology or lifestyle can potentially lead to improvements. Again, it doesn't mean the microbiome is in any way contributing or causing Parkinson's, but it suggests that that is one way, just like diet would be, right? Or preventing, let's say, a toxic exposure would be, right? Is just one way of, improving, the resiliency of an individual so that they can overcome what I believe to be an underlying etiology, which again is most likely genetic in many people. And why this is exciting is again the safety is the safety profiles of fecal transplants are quite remarkable. There have been tens of thousands of fecal transplants done for other conditions, gastrointestinal infections mostly, very little issue on safety. The protocols and the approvals, the regulatory path to get using fecal transplants as therapies are well established. So again, there aren't going to be bottlenecks such as one would experience by developing an entirely new drug, right? There has to be so much more safety studies that go into it, which we don't have to do in fecal transplants. And again, where we are in 2025, we don't really understand the actual biology of how the microbiome is, and we have some hypotheses that are being tested, but I don't think we have the conclusions yet to know what are the culprits that may be contributing to the symptoms or what are the organisms that may be beneficial. But when you use an entire wholesale fecal transplant, you sort of overcome that lack of knowledge and just transfer healthy microbiomes. And so I'm very bullish on this approach. It's something that we're modeling in the laboratory now, again, using mouse models where we have some really exquisite data showing that fecal transplants from healthy or wild type animals are not just prophylactic, but therapeutic in alpha-synuclein overexpressing mice, again, mice that show features of PD. And we're really trying to get to the underlying mechanism, and that's still ongoing work, but we think we're close to being able to identify exactly how a healthy microbiome can trigger events in the brain, a cascade of pathways in the brain that help clear alpha-synuclein aggregates and actually reverse existing motor symptoms. We still need to do a fair amount of work. But I think we're on track to understanding the underlying biology. And again, now coupled with what's happening already in the clinic, I think long term, what the preclinical work will allow us to do is to go out and identify who's going to be the ideal donor. What is the microbiome configuration that can actually confer health in PD? I think this is a shortcoming of all fecal transplant studies. Again, many, many hundreds of clinical studies that have already been reported, almost all outside of Parkinson's, where investigators just don't know who to go to for that, quote unquote, healthy sample. The mouse work will allow us to identify microbiome profile which correlates with health, and then we can go out and screen individuals for that particular profile, and maybe they are then improved or better donors for future clinical trials. So again, I think merging the preclinical work and the clinical work has lots of long-term value for people with Parkinson's.
I'm so excited about what you're talking about. And to be honest, I think that partly because it is safe, the way you talked about it's the safety, right? I mean, I think there are thousands of patients who are just waiting for you to get out of the preclinical phase with the mice and start
Right.
working with the humans. What is a timeline? Like, let's be realistic here. You're still preclinical. Is this like 5 years before there's even a human trial? Is this 10 years? I mean, I know this takes forever, but do you feel like it's in the near future, couple of years?
I do think it is a couple of years because, that is my estimate for when we would be able to identify a microbiome profile that's may be beneficial in humans. Again, using the animal studies where, obviously the research moves much faster and we can control conditions much better, as Roberta knows. But at the same time, there's still a gap between what we find in preclinical animal models and what may or may not work in people. So I think we'll get to that fingerprint, that potentially therapeutic microbiome fingerprint in a couple of years. And then what is heartening is, as we just discussed, is then the path to conducting those clinical trials is very well paved. I think the biggest bottleneck in most cases is the regulatory path, to getting a drug approved. And the regulatory path is already established. And so that, at least in the US, the Food and Drug Administration has very clear guidelines on fecal transplants. And again, they're very supportive of this work because from their perspective, and again, the many, many thousands of fecal transplants that have already been done, is that there's very little risk of safety. And again, the FDA is really just primarily concerned with safety and tolerability. And so I think the approvals are going to be, nothing's trivial, but more straightforward than a novel chemical, a new drug, for example. And this just expedites the clinical trials. And also what I think is working in our favor, or the favor of individuals with Parkinson's, is the motivation of the PD community, maybe reflected in that 2016 symposium, but certainly in the outreach that I receive, and colleagues of mine receive as in the microbiome field, work on Parkinson's, receive as well, is there are many, many individuals with Parkinson's who are very open to fecal transplants. Again, they've lived a life with their GI issues, and the proximity of the microbiome to the intestine, I think, opens up the potential that we can use that as a therapeutic route. And again, these are motivated individuals who would then, really, enable a clinical trial, because one of the other bottlenecks for clinical trials is enrollment, is just finding, not just people, but the right people, who meet particular criteria.
Right.
And so I think that this is something that, is assisted by a motivated patient community. And so again, I'm optimistic, not about the results. We don't know about the results, but at least about the potential of being able to design improved clinical trials in the next 2 to 3 years.
I do have a question about medications, though. May I go ahead and
Yeah,
of course.
so as we know, the microbes support gut health, and they help with digestion, and they have different roles in our gut. And many of people with Parkinson's, most of them, they take medications. Is there any study? Is anybody looking on how the microbes in our gut might be, if they are influencing the medications, the metabolism, or like how effective, for instance, levodopa is? Is there, anything that it's been studied right now from that front?
There are a couple of studies come to mind. There's at least one publication that I know of where authors correlated levodopa use to changes in the microbiome. So just an association, but there seems to be a drug microbiome interaction, which on its surface is not surprising. Our microbiome is very malleable. It's sort of like a rheostat, if you will, to what goes into our bodies, and adjusts accordingly. Now that adjustment may or may not manifest into any effects on disease course or the patient's experience. And there's more targeted work from Emily Bauskas and Peter Turnbaugh. Emily's at Harvard and Peter's at UCSF. Again, this is preclinical work, but they showed that that bacteria contain the enzyme that converts L-DOPA to dopamine. And so, as we all know, many individuals who are taking L-DOPA are also taking carbidopa to essentially increase the bioavailability of
Yeah.
L-DOPA so that L-DOPA can get in the brain and then be converted to dopamine and essentially replace the lost dopamine. Well, if you have organisms, again, and they've identified particular enzymes and organisms that can essentially convert L-DOPA to dopamine in the gut, and then dopamine is not going to cross the blood-brain barrier, so patients are not going to receive the benefits of their L-DOPA treatment. And so, I think there's, really interesting, from this work emerges a really interesting hypothesis that the variability in drug response may be due to the fact that there are certain enzymes that are essentially inactivating L-DOPA in some individuals, and maybe that's why they don't respond as well, or that they have variability in their response, or that the drug doesn't work for as long as it potentially could. And in fact, carbidopa doesn't inhibit the bacterial enzyme. And so I think that there's probably many more stories out there
Mhm.
like this. But then there's also one that we think about. There's no evidence for this yet, to my knowledge, but um, constipation in most individuals with PD, but also gastric emptying issues or other GI issues, essentially are a hallmark of an intestine that's not functioning properly, right? Contents are not moving through the system as they should, and the gut barrier, the intestinal wall, isn't performing its responsibility. So what is that responsibility? Very, very high level and it's crude, but you'll understand is that part of the responsibility of the intestine is to allow nutrients in and keep harmful molecules out. Right. And so if a gut is not working properly, then that also might, again, this is speculation, that also might result in variability of the drug response. I mean, the drug is not being absorbed as well, or is being degraded, or is not being absorbed in the right place, right? Because of just the erosion of gastrointestinal function. And so one hypothesis is that just repairing the gut itself may then lead to improved drug response because those drugs can then be absorbed and work the way they were intended to. So this could again be a byproduct of any strategy that improves the gut. And so just wanted to give you, again, a forward-looking potential to how targeting the gut may be beneficial for individuals with Parkinson's, in particular their ability to respond favorably to drugs.
This is very exciting. I know that there are so many people waiting to see what's happening in this space, and I'm wondering if the session that you're talking in next year in May is going to also be standing room only. I wouldn't be surprised. A lot of people show up with questions. Have you noticed? And I know you're still preclinical. You're not in humans right now, but is there any indication there might be a difference with gut health and microbiome between the genders, between men and women?
Uh, Eli, I don't know. I haven't. I'm sure the data. I'm not sure, but I suspect the data may be in the literature if one were to go into the clinical trials and parse out the gender effect. Um, but at least it hasn't been highlighted as being a significant factor because I think I would have seen it in those handful of studies where at least the fecal transplants have been done or the microbiome profiles have been done. Doesn't mean that there isn't an embedded signal. No, I guess there's also the low likelihood that there is a signal people just haven't looked. But again, I don't think that's too likely. But I don't, yeah, at least off the top of my head, recall a gender effect as it relates to the microbiome and PD.
Okay. Always like to ask that.
Yeah.
Good. That's a good question.
Gotta ask. Always good to ask.
And mouse models, I think, are probably not too informative
Sure.
about sex or in humans because many disorders that have a gender bias in people don't replicate in male versus female mice. And so I think again this is something that this is data that we have to acquire in humans. But again, the beauty is with the microbiome that actually acquiring microbiome data, like looking at a person's microbial signature, is relatively straightforward these days. And it's been done. There's 40 studies or so
Yeah.
profiling the microbiome in PD. And so at least getting that top line association between any feature, not just sex, but any feature and microbiome configuration. Like I said, there's a study on L-DOPA and or other sort of whether it's diet or lifestyle, those studies are quite amenable. There's no bottleneck to doing those those types of correlative studies now. But again, they're very important because then from those emerge hypotheses that can then be tested preclinically and ultimately clinically.
Amazing. Roberta, do you have any other questions? I know we're coming to the end of our podcast. This could go on much longer. Any final questions?
Yeah, maybe as everybody starts getting ready for the Congress, and maybe more so for patients and families that get ready, go through the program and try to figure out what are the sessions they want to attend. It may become a little bit overwhelming, right, to figure it out. But my question is like, how can the attendees best approach researchers and clinicians? Because that's the beauty of this Congress, right?
That's right.
To find people that come from different background and different, expertise, and they can all interact and talk to each other. So how do you advise a patient or a family member to interact with the experts during the Congress?
You want me to cover that, or
I can ask both of you if you want. But actually, from the point of view of Sarkis, like you're there, you're speaking about your science, and then you step down the podium, and then how do you think this conversation could happen? What would you like to share with a patient, like one-on-one?
I enjoy hearing people's personal stories, right? I mean, again, going back to the context in which we do research in a laboratory, right? With animal models, we don't, actively as part of our work, actively engage with individuals with Parkinson's. And so I do community outreach, and obviously there are many, opportunities that present themselves where I do interact with patients, and it really gives us and families and caregivers, but also neurologists, right, and just the entire support community for people with PD, and it really helps put our research into context and also gives us emotional motivation to continue the work that we're doing. And so the mechanism, I think, I'm sure there are built-in mechanisms at the WPC for all demographics, all parties to interact with each other. And, I find the PD community to be very engaging and not shy in approaching each other. But I think it's very informal, right? At least with me, is, whether it's prior to or after the session or the rest of the meeting, is I would hope people would walk up to me and, ask me questions, challenge our work, ask for advice, share their stories. I think there's anything that can both educate us and our research, but also help, individuals benefit from the work that we're doing. So Eli asked a question, that's very forward-looking about where, the work is going and when it may actually get to people. But I think there's also, again, just other ways of approaching the problem now, right? And I think just again, it'll come back to, just addressing gut health. There are, commercial products or over-the-counter products that improve gut health, and many of them have been tried in Parkinson's. But again, I think just dialogue and just exchanging ideas may lead to a spark, may lead to an idea or a connection that wasn't there. I call them hallway epiphanies, when you don't really, sort of have a conclusion until someone sparks that neuron or sparks that thought in your mind that makes the connection in a way that reveals an important outcome. And again, I think this is I'm always open to people approaching me and asking any and all questions.
I love it. And this is we have the person that started this podcast couldn't be with us here today, Edgar Valmanis from Norway, who lives with Parkinson's. He always talks about the WPC, and his favorite part of the WPC, he calls it the unconference. I don't think he didn't coin the term, it's out there, but he refers to it as those hallway conversations when you're at the hotel and you're sitting on the rooftop having a beer and you're talking. But one of the things he loves so much is that our lecturers and professors and doctors and researchers do hang out at the WPC. They don't just rush in and give a talk and run home. And to that point, for our listeners, Dr. Mazmanian is speaking on the pre-Congress day, but also hosting a roundtable the next day. So you could probably find Dr. Mazmanian, at the rooftop bar on Sunday night at the opening ceremony and have a chat with him about that, because he's going to be around for two different engagements, if not others. So it is exciting, and we're really, really pleased to have you back with us. This is a session I myself would really love to see. I have no idea if I'll have even a minute to pop into any sessions, but as a reminder, Dr. Mazmanian is speaking on Sunday, which is the pre-Congress day. I just pulled up the program to look at it, and the session's being moderated. It's gut immunity and Parkinson's disease, what we know so far from animal models, and it's being co-moderated by the amazing Ashley Harms and the amazing Malu Tanzi, two great co-moderators. And it'll be a handful of speakers: Dr. Marina Romero Ramos from Denmark, Joanne Stratton from Canada, and Dr. Mazmanian from the US. And this is going to be a great session. And it's going to be right before the opening ceremony, so everyone will be there. I'm sure the room's going to be packed. We'll probably have the fire marshals close the doors again, which is exciting. So this has been such a great podcast. I have one more fun question. So we always ask a fun question of our speakers, just to tell us a little bit about you when you're not doing the science, a little bit about your personality and who you are. If you so let's say you get stuck in an elevator, not a long lockdown, just a little bit. Who would you love to be stuck in the elevator with?
That's a good question. I'm going to have to think about this one.
No, space-time continuum is out the window. It could be anybody.
Yeah, I'm trying to think of someone who is in an area or thought process that's very, very different than mine. Maybe just the generic answer then is someone that I can learn something from, someone who again has a different background, a different expertise, or just a different perspective. And that conversation would hopefully be educational.
I love that. It's a great answer. Okay, one more kind of personal question. You are going to the music world here. You're trapped on a deserted island. You happen to have a record player that's solar powered, so you can play a record. You have to have one record with you. What would it be? What one song or record are you playing with you on your desert island?
It would have to be a Bob Dylan record.
I love it. Old or new? An old.
Old. Definitely old.
Old music is the best.
Old Bob Dylan. Well, especially Bob Dylan. He's had, I think, 5 lives and performs so differently every 10 years. Amazing. Okay, so Bob Dylan, and you're a learner, so you want to be trapped with someone who could teach you something you don't already know. I love it. Well, this has been honestly so fun. I'm so glad I know we struggled to find a time that worked for us. I'm really happy that we were able to find this time to have this conversation with you. I am so excited to have you back at the WPC. Really a 10-year hiatus. A lot of things have changed, and in some way, some things haven't changed at all. So it'll be very interesting just to have you back up on the stage. And I think our delegates across the spectrum, people with Parkinson's, the researchers, the clinicians, all are very excited to hear your talk. So thank you so much for agreeing to come next year in May, but also agreeing to have this conversation today with me and with Roberta. It was really an absolute pleasure. Thank you.
Thank you, Eli. Thank you,
Thank you
Roberta.
so much. Thank you. Bye.
All right. Thanks, everyone.
Thank you for joining the Hear Here Parkinson's podcast. If you would like to experience the next World Parkinson Congress for yourself, to feel and see the change in real time, save the date to join us from May 24th to the 27th, 2026 in Phoenix, Arizona. Learn more at WPC2026.org. This podcast series is made possible with support from Blue Rock Therapeutics.